Hi, how are you doing? It's Chow for your best mix of music, 98.4 Capital FM. I am at the Nairobi Hospital. Now, if you don't know, November is Lung Cancer Awareness Month, and I'm very privileged to be in the company of Dr. Andrew Odhiambo, who's an oncologist at the Nairobi Hospital. Thank you so much for joining me.
Thank you so much for having me.
Let's talk about lung cancer. The greatest misconception is that it is only caused by smoking. Perhaps you could start off by letting us know what lung cancer really is and what some of the causes are.
You could have primary lung cancer and secondary lung cancer. So by far the commonest cancers that affect the lung are secondary lung cancers, which means that you may have had cancer somewhere else, maybe in the breast or in the ovary or in the kidney, and then that cancer migrates through the blood system into the lung. So that I see sometimes people on TV saying that, I had breast cancer, then I had lung cancer. No, you had breast cancer which went to the lung. So that's a secondary lung tumor. So for this month of November, we promote awareness for primary lung cancer, which means that this is cancer that started growing within the lung tissue. And sometimes if it stays for so long, then it can spread to other parts of the body. Lung cancer is not only caused by smoking as what many people would think that that's the cause. There are very many other causes, and it depends on which setting you are in. For example, in areas where a lot of the building material has got asbestos and all those chemicals that are used in paint and so on and so forth, that can lead to lung cancer. Traditionally, people who used to build ships and so on would get exposed to a lot of these very weird chemicals, and that will lead to lung cancer. We think in our setup, as much as we don't smoke so much, I think long-term exposure to biomass fuels, which is the kuni in pots that people used to cook with, at home.
So our grandparents
in the poorly ventilated,
areas.
tiny huts, and they're just putting firewood in a room and cooking and inhaling the smoke, and probably that may be predisposing people to lung cancer. A lot of it may depend on your genetic makeup, maybe. So probably in your family, if you've got these types of cancers that are inherited, then that could account for some of the cases of lung cancer. There's not so much to do with diet and lung cancer, but we think that overweight and obesity predisposes people to not only lung cancer but many other types of cancers. Chronic lung conditions that stay for a long time, like people who've had tuberculosis over and over again and their lungs have been damaged, those people can then go on to develop lung cancer. And then finally, smoking.
Right. So it does come at the bottom of the food chain, whereas
not really at the bottom.
Okay.
But the point is, not all lung cancer patients have to have smoked to have developed lung cancer, and the vice versa is also true. And I think this is important because a lot of lung cancer patients face stigma. Because then, even the doctor will ask you, so how long have you been smoking? And then you'll be like, no, I don't smoke.
I don't even
I've
smoke.
never smoked, and I don't live with anybody who smokes, yet the patient has lung cancer.
What are the numbers we're looking at men vis-a-vis women coming into your referral office who are exhibiting signs of lung cancer, or who do have lung cancer?
So let me start by saying, in the West, in Europe, in America, and the northern countries, lung cancer is probably the top most prevalent cancer. In Africa, outside maybe Egypt and South Africa, lung cancer is not very common. In Kenya, based on the latest statistics by Global Resource, put lung cancer at number 18 out of 20, with approximately maybe about 900 new cases per year. I'm not sure about those estimates, but that's a quite significant number. So it's not very common. So you put it there at about number 18, and we tend to see more women, at least in my practice. It's more of a middle-aged to elderly woman disease, at least in the last 5 years. Men also do get lung cancer, and coincidentally, if it's in a month, probably they'll be the ones who will be the smokers. I'm not saying that women don't smoke, but in all my female patients, non-smokers, they don't even live with smokers. The average age is probably about mid-50s to early 60s, and it would be different within the regions. I'm not sure those oncologists, practicing maybe in Eldoret and Kisumu type regions, probably they are seeing a slightly different demographic.
When people come into your office, the oncologist's office, what stage of lung cancer are they at, and what do you think is causing maybe the lack of detection, early detection for lung cancer?
So sadly, I must say, lung cancer is difficult to diagnose early unless you have been isolated as a case that would benefit from screening. This happens in the Western world. If you've smoked X amount of cigarettes, maybe for the last 30, 40 years, then you're put on a screening program where you go for what we call a low-dose CT scan to try and catch very early tumors. The earlier you catch the tumors, the easier it is to treat and the higher chances of cure. Our patients locally will present to the doctor with coughing, a chronic cough. Sometimes they're losing weight. Sometimes they may have specks of blood when they cough. Sometimes they may have weird kind of shoulder pain or back pain. And so any doctor would immediately diagnose this patient with pneumonia or tuberculosis, for example, and initiate them on antibiotics or anti-TB drugs. The patients would then take these drugs for months and months without improvement. By the time we are realizing that this is not an infection, that this is lung cancer, it is almost always too late. At least in the last maybe 5 years in my practice, probably more than 95% of the patients are stage 4 at the time they are coming to my office. The very few who might be lucky to be stage 3, and maybe the stage 1s and 2s are those who probably are going for scans for other reasons. Maybe you're getting a new job and they tell you must do an x-ray, then you do an x-ray and then you find a small tumor. But most people who are actually having symptoms will have stage 4, will have stage 4 tumors.
You talked about some of the patients coming into your office, to an oncologist's office, will be told, I was getting treated for TB for a long amount of time. What is happening there? Because I'm not too sure, and maybe from a medical perspective.
So let me explain how this worked. So in the late 90s, early 2000s, we had a lot of HIV, and HIV comes with tuberculosis. So all the support and donations we got were to train people towards getting rid of HIV, and TB happened to be integrated into part of those programs. So most of the doctors, clinicians, nurses, everybody knows how to diagnose TB. We have little checklists where if somebody has been coughing for more than 2 weeks, losing weight, coughing blood, if they have 3 or more of the things on that list, then they have the right to be given TB drugs. So now that HIV is under the blanket, and people with HIV are actually living well and living longer, we have forgotten to retrain people that not everything that coughs is TB, but people could have, lung cancer. And so we need to start thinking differently. If somebody actually is coughing for more than 2 weeks and they're losing weight, as much as you're thinking towards TB, think about also the possibility of lung cancer and refer these patients to a center where they can have tests to separate the two. If you don't have good, maybe computer scans and so on and so forth, you really can't tell the difference by doing a normal x-ray. And you as a patient, if you are being treated for a disease repeatedly, even if it's, amoeba of the stomach and whatnot, and things are not getting better, ask for a second opinion. Ask to be sent to a doctor who can try to figure out what's wrong with you. You can't be taking drugs for a condition and not getting better, and then keep on taking them. Sometimes the doctor is not always right. So
it's really important that the referral system, even as a patient, you say, I would like a second opinion, and keep getting those referrals until you find out what is wrong with you.
Definitely.
Wow.
All my patients, at least in the last 24 months, who've been referred to me with lung cancer, all of them have been on TB drugs for 3 months and longer.
That's really, really interesting. Oh, wow. With all the information that you've shared with us today, my question would be, how often do we need to get screened for lung cancer, and at what age? Because various illnesses have a screening process?
If you're not at risk for lung cancer, then you don't benefit from screening. You'll actually be getting unnecessary exposure to radiation, which could be harmful to you. But if you have a genetic syndrome or problem which we have identified, or if you're a chronic heavy smoker and you have qualified, maybe you've been smoking for 30, 40 years, a packet a day, then that's the type of person who needs to go for screening. And once you cross the line, it doesn't matter about the age. You could be 40, you could be 50, you could be 60. So that's the type of patient who needs to go into the CT scan machine. But then we call it a low dose CT scan, and then you go through the screening. I think it's once every year to make sure that we're not missing any tiny lump. So it's not for everyone, it's only for the particular group of patients who are at an unusually high risk of developing lung cancer.
Well, what would be your takeaway now that it's Lung Cancer Awareness Month?
So
today?
I would say, as much as lung cancer isn't common in our setup, I would urge the viewers, one, to shun away tobacco and be very strong against the use of tobacco and tobacco-related products. I think the people who deal with legislation need to take this up and really ban smoking, like completely, and teach it like in schools, and the little kids should know that smoking is bad. On top of that, if you know anybody who's been coughing for a long time, who's losing weight and is just on antibiotics over and over and over, they need to be referred to a level facility where they can be diagnosed or they can be checked to see if they have lung cancer. I must say, a lot of the fancy research right now in the Western world is in lung cancer. There are very many exciting new drugs that are giving patients a much longer life that they didn't have. Lung cancer patients used to last about 6 to 8 months, and now they are encroaching onto 3-4 years with these new types of targeted therapy, immunotherapy. So there's exciting news at the end of the tunnel, but you must make the diagnosis fast, because if you succumb before we even know that you have lung cancer, then we don't even have the chance to treat you with all this new fancy medication and technology. Is
this medication and technology, the immunotherapy, is it available here, or will we see it soon? So
it is. I have a couple of patients on immunotherapy and targeted treatment. It is here. It's still very expensive, but the more you use something, the cheaper it will become. Before we used to say there are some antibiotics that previously were very expensive 10 years ago, but now they're available and they're very cheap. So soon they will be available, they'll be very cheap, and we'll be able to use them for our patients.
Thank you so much for your time and for enlightening us on lung cancer, and of course the awareness that it's not just smoking that causes it, there's also other factors as well. That's it for this month of November. Remember, it's Lung Cancer Awareness Month. I'm at the Nairobi Hospital, and I've been speaking to Dr. Andrew Odhiambo, who's an oncologist who's been educating us on lung cancer and awareness. Until next month, ciao.